You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures, according to my first guest. With us, we have an expert on the topic. He is board certified in oral and maxillofacial surgery, Dr. David Gilbert. Dr. Gilbert, welcome to the program.
Thank you, Randy.
Now, and I know you brought a lot of photos.
I did.
And we should mention at the top of the show that people walk in your office and they could walk in without teeth and walk out with a fixed set of teeth. So that's possible today.
Absolutely.
Okay, good. Now, for people that don't know your practice, who's the typical patient and what are the different procedures you do?
Well, as you know, an oral and maxillofacial surgery, we spend a lot of time in the mouth,
Okay.
and we also spend a lot of time on the face.
Okay.
So we see a lot of dental implant patients like we're about to talk about.
Okay.
The dental implant patients can be a myriad of people. It can be a single tooth that's missing, or, for example, the denture patient that's missing teeth, not aware of the possibilities that are out there for them to have a fixed set of teeth, something that's comfortable, something that's secure. Many of our patients have teeth, but they're not in great shape. They just simply avoid the dentist, knowing fully well that their teeth are on the way out. We see those patients and are able to remove the bad teeth, give them teeth on dental implants, and give them security, comfort, and a great smile.
Okay, great. And you also do like some cosmetic surgery.
I do.
Is that right?
Yes, I do. The maxillofacial side of things includes facial cosmetic surgery. So we do the myriad of things from facelifts, noses, etc., to complex reconstructions for tumors and jaw deformities and patients with significant ablative defects from cancer surgeries.
Okay, good. Now we're talking, if you're just tuning in, we're talking about no more dentures. Getting something, either a fixed set of teeth in your mouth,
Yes.
or something that snaps in and snaps out for people wearing dentures. And you're an oral surgeon.
I am.
And this is interesting. People need to know it's a real interview. I'm not endorsing Dr. Gilbert here, but it doesn't cost more to go to an oral surgeon. Is that correct? A specialist?
It doesn't. A specialist it costs the same as seeing a non-specialist. The beauty of it is it comes with extensive training and experience. And if I were seeking a service, I'm looking for someone with a lot of experience and someone who's board certified. It really makes a difference in terms of the service that they're going to receive. And
what are the different categories? If you had to categorize the dental implant patients you see, what are they?
well, you know, it's really about 4 basic categories. There are many people missing a single tooth, and they have the opportunity to have a dental implant and restore their smile in the most natural appearing way. Many patients we see miss a number of teeth, and we can also do replacements with dental implants. I think the last 2 categories probably come under the same single category, and that is those patients without teeth wearing dentures, or those who have some teeth but they're really on their last leg, if you will, and are about to lose all their teeth. And these patients are going to be wearing dentures or something like it in the very near future. For those patients who are losing all their teeth, we can take their teeth out, restore health, get rid of those diseased teeth, and place implants with something fixed, and in many times give them that on the same day.
But these people, though, like you say, okay, so they haven't been to the dentist maybe 10, 15 years. They have bad gums.
Yeah.
Dental implants will still work for these people?
Yes. That's the problem with some of these patients. Unfortunately, they don't think they're good candidates, and unfortunately, it keeps them from exploring a great opportunity. These patients are probably the most rewarding because they've spent a long time staying away from the dentist because they don't think they're worthy of it.
Okay.
And it's a sad thing, but an even happier thing for us when we are able to give them something they've always desired. That is something that's aesthetically pleasing, something that's pain-free, and something that they can depend on. They can bite into food that they haven't in years. Denture patients are similar. They avoid the dentist because they don't need to see them, typically.
Okay.
If you have no teeth, you probably do not need a dentist unless your dentures are ill-fitting. But many people wear ill-fitting dentures. They just don't seek to get
Are there a lot of people
solution.
wearing dentures?
Absolutely.
You know, we talked in the green room, and you said that there's a lot of people with dentures.
As a dentist,
Like within an hour of your practice, what would you say? How many people? Tens of thousands?
yeah, we can fill one of those soccer stadiums with denture wearers.
Like an upper or lower denture, really?
I think so.
If it's so good, though, that you're saying like 2, 4, 6 implants to give them a fixed set of teeth, why aren't they all doing it?
Well, if you don't have teeth or you don't have dental pain, you probably are not going to see the dentist.
Okay.
But if you don't know that there's a solution for you that can give you solid teeth and probably do so in a single procedure, you're probably not going to seek dental care. We're seeing these patients and giving them these solutions that they've only dreamed about, where they can get rid of these loose dentures, these dentures that cause pain when they don't fit well. Because when you don't have a proper fitting denture, your denture is pushing on just loose gum tissues, and that's a very uncomfortable thing. Most of these people just avoid certain foods that you and I take for granted. You and I crave having a really nice steak.
Like I had an apple this morning. A denture wearer can't bite into an apple?
I've never really seen someone do that with a denture.
Okay,
I can't
you have to cut up the
imagine.
apple.
I can't imagine that they would be able to do that. That is something that is within their reach. They can literally eat corn on the cob, take a piece out of an apple, or have a great steak.
So if you give them a fixed set of teeth, they could basically eat anything that
Yeah.
you could with your regular teeth?
I've had patients tell me they were able to go out and eat their first set of ribs they had in years. Now, you and I don't always think of ribs as something that, is a luxury. But for these people,
Good.
it really is.
What about pain? I mean, it seems painful.
It's virtually pain-free. We very rarely see patients with any complaints.
So it's, I mean, virtually painless.
Yes, I mean, one of the biggest things we talked about is patients not coming in to see us because they don't think they can have this treatment. And one of the patients I saw most recently was in a lot of pain. She finally made that decision to get this procedure done. And one of her first responses to me after surgery, and I usually see the patients the day after to see how well they're doing, was, I can't believe I had this done, and I can't believe how very little discomfort I have. And that is something, to my surprise still to this day, that we hear on a daily basis. And it makes it very fulfilling for us.
So you also said that you're changing people's lives.
Yeah, and
Like how?
When we think of changing lives, we think of these big procedures, like we would with a cancer surgery or accident reconstruction. And while those things are changing their lives for the better, it's almost immediate that we hear the change with these patients.
Okay.
These people come in.
We're talking about denture wearers.
We're talking about
but now
denture
get a
wearers.
fixed set of teeth in their
Yeah.
mouth. Okay.
They are able to experience that life transition, that life change immediately. When we can take them from wearing loose teeth, which they're very insecure about, to walking out with solid teeth that they can smile, and actually to hear of their spouses or family members who come to drive them home echo how amazing they look on that same day is just simply not just life-changing for that patient, life-changing for us. And it really is a rewarding procedure.
Do the teeth look real? Can you make them look real? Because I feel like I could spot a denture. I think I told you that, walking down the street.
Yeah, the Hollywood smile, those perfect whites that are straight in a row, may not necessarily be natural. We spend a lot of time with artists and dental labs, phenomenal dentists with whom we work, spending time to make this look natural.
Okay.
It should be a subtle change where people who even know you wonder, there's something about that person, you know, and that's what we're after.
Well, good. Now you brought photos. What are we looking at here?
I did. Well, here's a patient that we just would have spoken about. This is a true life changer. She had been literally what she called locked up in her apartment for years, unable to socialize. She talks about failed relationships, or a failed relationship one, and she had not even been out shopping. And just because of the concern she had for her dentition that was just failing.
Her teeth. Her teeth.
A patient like this has two options, and it's one where we take all of their teeth out, get rid of those diseased and painful teeth and give them dentures. That's been the tried and true technique, if you will, for many years. Okay. In fact, that was the reason she didn't come in. She did not want to wear dentures. That's not where she wanted to go with her life. And that's what made her even more so depressed.
So what'd you do?
So we took out those teeth, and on the same day we removed them, we placed dental implants, both upper and lower dental implants. And we were able to attach permanent teeth on the same day, or fixed teeth, that she can walk out with that were so much nicer than her existing teeth.
Let's take a look. This is very nice.
Now, why don't you take a closer look at her?
Okay.
I mean, look at her before picture. You can tell what's wrong there, right? I mean, those teeth are long, the gums are receded, they're discolored, they're crowded. Look at her after. Look at those natural appearing teeth. Look at her smile. It's a lot more confident, a less strained smile, if you will. In fact, on the before picture, we had to force her to try to smile.
So she's walking around not smiling.
Yeah, you wouldn't smile if you had terrible teeth, and
okay.
that's one of the challenges with all these patients, is that they're not confident with their smile. They are uncomfortable with who they are. Look at the full face pictures that you have in front of you.
Okay.
You know, look at her face in terms of age. You probably think that you're looking at a younger person.
Yeah, she looks younger.
Surgery, but she looks even more sophisticated than she ever has.
True.
You know, most of these people look at themselves in the mirror and they don't like who they see. And unfortunately, that starts changing their personalities. Many people walk around today thinking some of these people are not friendly, they're moody, and really, in fact, these people are emotionally challenged.
Just hiding their teeth.
Just hiding.
Interesting.
And that is the beauty of this particular patient. She is such a different person today. She is going out, she is socializing. Photography has always been a hobby of hers. She is planning on moving to the beach. She wants to do ocean photography. These are the things that people can explore that they didn't have the opportunity to have the confidence doing before. They may have been able to do it, they just didn't have the confidence to go out and do it. And this is where many of us are able to help these patients achieve what they're looking for.
How old could you be to do this?
Well,
like a 70-year-old, 80-year-old?
Yeah.
I mean, that's young today, but can you do it at that age?
Yes. I think if you need teeth and you're unable to eat, age is really not the factor. The question probably is how healthy they are to undergo the procedure.
What's your oldest patient?
103.
Are you kidding me? You put a 103-year-old with dental implants?
Well, I'm not quite sure I should be proud of that or how
You
I
had
should
to have
feel.
been scared.
I was very scared.
Did they fall out afterwards?
Interestingly, this patient had implants on many occasions, so they had a value for what they can do for them. And at 103, he was losing yet another one of his teeth and insisted he had a dental implant. So
and it worked. It worked.
It worked.
So with this particular lady, because you do this all-on-4 procedure, all-on-6 procedure, what even does that mean? What is that?
Well, all-on-4 is a technique where we can take someone without teeth, wearing a denture, or remove all their teeth, and restore a full set of fixed teeth using 4 implants only.
Okay.
And it's been proven successful on numerous studies. We can use 2 implants to secure a denture. It's probably the most night and day experience for someone.
Like snap in, snap out.
Snap in dentures. And for someone who's currently wearing a denture, 2 implants are a phenomenal transition. To know that that denture is simply not going to fall out when they speak or try to eat something at a
No
restaurant.
adhesive at all? Or just in the back?
No adhesive.
Okay.
No adhesive. But the all-on-4 procedure is for someone who wants something solid, something that's fixated, something that is going to be like natural teeth, where they go to bed with it.
Okay.
Many patients, as you know, wear dentures or snap-in dentures, and they take them out at night. Even their spouses are not allowed to see them without teeth. And the all-on-4 procedure allows someone to actually keep these teeth on a permanent basis, where they don't have to take them on and off.
Now you like this 6, like all-on-6, like a full arch of teeth on 6.
I do, particularly for the upper jaw. The upper jaw has a lot softer bone than the lower jaw. We almost routinely use 4 in the lower jaw, and it's a very secure way to go. I'm a little more comfortable with 2 more. It doesn't change the invasiveness of the procedure. It just gives us something a lot more predictable and something that I feel a lot more comfortable giving my patients. Take a look at this side shot.
Okay, this is the same woman again.
Yeah. Most people, don't see themselves from that perspective, but the rest of us do. For example, if you're at a social gathering, you're probably going to catch somebody in profile. If patients were to see themselves in profile, as you see in this patient,
Big difference for her.
Big difference.
I mean, is this typical? People come in with, just failing teeth, and then you give them this.
Very typical. In fact, one of the larger group of patients we see for this particular procedure are those busy executives, busy business people, adults with very little time. They don't have time to come in, take out teeth, wait, wear dentures, and in the meantime carry on with their lives. So one of the patients that we typically see would be someone who they know they need this procedure. They just don't have the time because they have a busy schedule. And I want you to take a look at this gentleman.
Okay.
He had a similar situation as our previous patient, but his biggest directive for us is, listen, I don't want to take a week off. I cannot afford to take a week off.
So this guy's teeth had to go?
They had to go.
Okay.
They had to go.
So he had a choice, dentures or get his teeth back with dental implants?
Or all on 4 or all on 6.
Okay.
But dentures were just not a choice he was willing to entertain. It's not something he was willing to entertain. He presents to people on a daily basis. He's doing presentations to large groups. Denture patients, their speech is not always the greatest. They can lisp, they can really have challenges with presentation skills. For him, he wanted something natural appearing, something that was fixed, and something that didn't take much time, nor a big recovery period where he would have to take time off.
Okay.
So we were able to do this procedure where he came in, we removed the teeth. With careful placement of those implants, we were able to place teeth on those the same day. He was able to travel.
So walks in without teeth?
Walks out. Well, he walked in with some terrible teeth.
And walked
out with some better solid teeth.
So he can eat whatever he wants. How soon can they eat?
We give them the opportunity to eat right away.
Okay.
But obviously, when you have surgery, you're numb from the surgery itself. So we ask you to stay on a liquid diet until that numbness from the surgery goes away. But they can have soft foods. We advise patients to really stay on things like mashed potatoes, soups, pastas, things of that nature.
Like for a week, a couple weeks?
We ask them to do that for about 4 to 6 weeks.
Okay.
Because while they can truly chew, you have to understand that we give them these teeth to solve the problem of the looks and the security issue, in addition to the function. But implants need some time to lock themselves into the bone. And while they can chew, by putting excessive forces on those implants, we're asking just a little too much of them in the first 6 weeks. So
okay.
We ask patients to stay on a soft diet for 6 weeks. It's a great way to ensure that these implants have a nice, safe, gentle time.
What about pain? Again, it does seem painful.
Yeah, and
Did he complain about pain the whole time?
Some of these patients could be, particularly guys, the biggest, I hate to say it, biggest babies, because that's probably one of the things that may also be keeping patients. They think of this as a painful thing. When they're able to have this procedure and on a repeated basis tell us how very little discomfort they had, we're able to assure patients that this is a fairly comfortable procedure for as much as they're getting done. Here's another patient. Look at this lady. Look at her face. I mean, that is not the face of a happy...
She looks sad.
She is. And this is the life she's been living for years. When you look at her after photograph, you're going to be blown away.
Okay.
You will tell from looking at that photograph that she is a happier person.
Okay.
And there are many people like this who walk around on a day-to-day basis who are very emotionally withdrawn, who are reclusive, who are sad because of their dental condition. With simple teeth, she had a complete dental and facial makeover. Now this lady had both upper and lower teeth placed in at the same time.
Okay.
And look at her face. You can see...
Wow, the after looks great.
It's not just her smile, it's her entire
Yeah,
face.
yeah.
She's glowing. Look at the support of her soft tissues. Look at the lips. Many times when people are aging or wear dentures, their lips are really thin, and that gives a senescent, older look. When you have teeth that are supporting those lips, they look fuller, they look more youthful. And when you feel more youthful, you smile, you feel better,
Okay.
you look better. And interestingly enough, most of these patients, when they look at her before picture and look at her after, you'll see that she has no problems wearing makeup again. She feels like she's worthy of looking good again. And interestingly, these people, it's a 180-degree change for them, not just in their ability to eat, but in the way they feel and interact with her family and friends. And this is something we see with so many patients. There's so many patients out there sitting down, wondering what are their options when they have no teeth, or that they have teeth that are missing or about to go. When you have teeth that are failing, it affects your health. And many times silently. We know today that diseased teeth cause major issues with systemic health, particularly cardiovascular health.
Okay.
And while patients may not be aware of this, they're doing themselves an injustice by holding on to these diseased teeth. They need to see a dentist. They need to either clean up these teeth, or if they can't be cleaned and saved, remove them.
Now with this woman, because this looks like veneers or like a smile makeover. So that's like a denture.
It is
locked in there.
It is a smile makeover, and there are teeth that are supported by implants that are permanently fixed for her. So yes, it's a dental makeover.
What does she say? And what do they typically say when it's all done?
That they can go back to living their life that they used to live, or they remember living, prior to this slow, progressive deterioration that they had.
Interesting.
They feel restored, both emotionally and physically. And the beauty about this, for me as a oral surgeon, is that we feel like we're making a positive change for these people and their families, because we're giving these people back to their families who are now happier, fulfilled, comfortable, and energized.
And they smile more.
They smile
So maybe
more.
they're happier because of that.
You would think, yes.
So is this one of those things where they say, I should have done this years ago? Because I think you told me in the green room, people are miserable for like 15 years before they finally do something.
Most of these people
So what do you say to those people that are watching this?
I tell them, you too can get your life back. You too can have this transition with minimal discomfort, with minimal downtime.
I never had any trauma. I mean, I came in, you guys put me to sleep, and when I woke up, I had a fixed temporary. Nobody knew. Everybody just knew I looked better, that I looked amazing. All I've been doing since I got this is go, 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 go. I'm out, I'm smiling, it's fun. It is, it's a blast. I never realized, but basically I forgot, I'm a really happy person. I'm a happy, positive, happy-go-lucky person. I like to take chances. I like to try new things. I like to meet people. I like to be sociable. And I'm right back in there, full speed, yeah.
I talk, I'm happy, I can eat. I had an In-N-Out hamburger. I mean, I actually held it in my hand instead of cutting it in little tiny pieces. I held it in my hand and I actually bit down on it. Now I have energy, I want to go, I'm cleaning my house, really cleaning. I feel like a kid, I really do. I mean, I'm bubbly, I'm happy. If you can do this, do it. Don't hesitate, don't think about it, just do it.
For people watching this, because we said at the top of the show, no more dentures. You're of the belief, and I don't want to put words in your mouth, that the denture wearer should have at least 2 implants, 4 implants, 6 implants to either get something that snaps in, snaps out, or a locked set of teeth. You believe everybody should at least make the change over to that?
I think it goes beyond me. It's a standard of care.
Okay.
And the reality is, this is something that patients will benefit from. This is something that is not a luxury. It's an absolute need. It's a need.
Now, insurance throughout the U.S. does not cover the whole implant procedure.
Unfortunately,
Medicare does not cover dental implants as well.
That's
so what
true.
do you do?
That's true.
Not everybody has the cash. You have finance?
Yeah, fortunately,
plan?
we have ways of financing this for patients. And there are ways that we can help them receive this treatment, even though insurances don't cover it. And many patients will finance it, particularly through third-party financiers.
Okay. And finally, we should mention, without me being too much on your side, because people always, they go to our website and they ask me for referrals, about a plastic surgeon. And I always say go to a specialist. And without endorsing you, the fact is you're an oral surgeon. You said it doesn't cost more to go to an oral surgeon, right? To go to literally an expert on this particular topic.
The reality is...
It doesn't cost more to go to you. Is that true? Okay.
It doesn't. The service is the same. The person providing it is different. As a specialist, we carry with us a slew of training and expertise that is tested by our peers. Yeah.
Now, I know you didn't want to go negative today, but I have oral surgeons that are friends. And they have told me, Randy, I'm seeing more and more of these weekend course guys because we're fixing their problems. Right?
Well, yes.
Do you fix other people's problems?
We do. And
inexperienced guys' problems?
As a specialist, that's what we're there for. We handle the more challenging situations, the ones that are not doing as well and that we have to take over or help out with. But that's where we do a lot. That's where I think the value of teaching and what we do helps. I think...
so get it done right the first time.
You get it done right the first time.
Now, one thing, and I know you want to talk about, we're out of time though, but I mean, you believe that you have like the premier center.
I do.
As far as, even customer service, patient service, with technology and everything else, a word on that.
You've known me for a while. You know how passionate I am about customer service. And I really believe that everything should be aligned. The surgeon should be excellent, the service should be excellent, but the environment in which we do so should be also the same. And we have developed the surgery center and Center of Excellence, and we believe that it meets and exceeds international standards.
So IV sedation, most of these patients, they go in, they go to sleep, and they wake up and they have teeth.
These patients they take a little nap, they wake up with the final product, and
very nice.
They're able to be comfortable.
I want to thank you for coming to the show.
Thank you, Randy.
Very good, very good. You've been watching The Wellness Hour. I'm Randy Alvarez. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.